Good afternoon, everyone. My name is Philippa, and I'm going to talk to you today about the work that I'm involved in as part of the DOMINO-HD study surrounding the use of wearable activity trackers in clinical studies. DOMINO-HD is a European-wide consortium funded through JPND and consisting of 5 clinical partners, along with medical engineering and computer science input and EHA representation. The study aims to investigate the use of digital technologies in a longitudinal observational study to inform our understanding of the contribution of multi-domain, lifestyle, and genetic factors in the progression of Huntington's. I'd like to take the opportunity to draw your attention to a number of posters being presented at this meeting by researchers across our consortium for those interested in learning more about the broader research that we are undertaking. My talk today is going to focus on the technical approach taken as part of DOMINO-HD to embed a consumer activity tracker into a clinical study, with particular reference to the data handling processes. Firstly, I'd like to recap on what wearable activity trackers actually are and how they work. To put simply, they are devices made up of numerous sensors that are worn on the body, typically on the wrist, and when worn whilst undergoing daily routine, the device is linked to a smartphone or a tablet and gives lots of detailed information about activity levels, and numerous health metrics are provided. And these devices are becoming more and more popular in society and place a minimum amount of burden on the user. And this is due to the fact that they have user-friendly design, their reasonable battery life, and robust remote data transfer processes via the cloud. And they offer a range of metrics that we as researchers are very interested in. And if they work as intended, they could provide a genuine platform for longitudinal monitoring. I say if in that statement, as in order to be useful, we need to make sure that the device is validated for a given application. And this is something that DOMINO-HD are working hard to investigate. And I'd like to direct you to our poster representation again for further information on how we're planning to do that. And after considerable thought and discussion as a consortium, we decided to integrate a Fitbit device into our study. And so I will now focus on the steps that we had to take to achieve this. Whilst there are many benefits to using a consumer device, such as a Fitbit, one of the main limitations is that they are designed specifically for individuals to monitor their own health and well-being and lifestyle. This means that they're not really designed for centralized data collection, which is needed in large clinical studies. So a significant amount of thinking needs to go into determining the best way to access and retrieve data from multiple participants simultaneously. This is going to be the focus of the rest of this presentation. One way of capturing Fitbit data is in a centralized way through a third-party platform, as these have been specifically designed to support research studies, with Fitbase being the official Fitbit partner. And these platforms will work in a very similar way. They connect up to the Fitbit server, request data from that server from the people who have signed up to a study and who have granted access to those researchers to retrieve the data, and then pull the data down into a platform where researchers can log in and access the data from all of their participants at once. And whilst we were looking into these options, we also came across a research team in DCU in Dublin, led by Professor Thomas Ward, that had experience in developing bespoke Fitbit platforms for research purposes, and who are in the process of creating a spin-out company offering this service called In the Wild. And after a thorough review of these processes, we decided to collaborate with DC partners to build a custom platform for our needs. And the details of how this platform were developed is now going to be presented. Firstly, we needed to get to grips with the freely available Fitbit Developer API, with API standing for Application Programming Interface, and simply put, means a package where software developers can use to integrate and connect with the Fitbit server and pull data down that they have permission to access. This meant that we had to have a deep dive into the documentation. We had to learn the procedures for registering users to our study, which involved creating a separate website for clinical sites to use. We had to learn how the metrics were structured, and we found that they were in JSON format. And we had to understand how specifically to make requests to the Fitbit server to receive data as and when participants upload their data into the Fitbit cloud. Unfortunately, we were able to capitalise on the experience and knowledge of the DCU team and work together to interpret this highly technical information. Next, we needed to decide which metrics we wanted to measure and whether or not they would be useful to our overarching research questions. This is an important step, as activity trackers typically calculate a vast array of metrics, which when collected over a long period of time can result in extremely large data sets. Furthermore, good clinical practice dictates that we should only collect data that we need, and so we had to determine which metrics we needed to collect and which that we could refrain from retrieving from the Fitbit server to keep our data in a manageable size. We decided to focus our attention on activity intensity, steps, heart rate, calories, METs, and sleep, and realized that these needed to be collected at minute level granularity. And that required the completion of an intraday access request with Fitbit, which was a very straightforward process and quite quick to complete. Our attention then shifted to developing a plan to monitor the Fitbit data, as being able to identify high levels of missing data is obviously very important when collecting data longitudinally, so that you can try to fix any issues as quickly as possible to maximize the amount and the quality of the data coming in. So we began this process by using heart rate data from the Fitbit to measure whether a participant was wearing their device at any given time. And that was again at minute level granularity. So put simply, when we receive heart rate data from a given minute, from a given device, then we make the assumption that the device is being worn. And if we fail to receive that minute level heart rate data, then we make the assumption the device is not being worn. Next, we had to define a threshold that indicated that sufficient data was being received so that any given day could be labeled as a successful or an unsuccessful data collection day. We chose a 10-hour threshold for this purpose, which is routinely used in physical activity monitoring research literature, where 10 hours or more of wear time on a given day indicates that a successful data collection day has been performed. We then had to agree a process that enabled us to contact our participants to remind them to wear their Fitbit and also to follow up with those who had large amounts of missing data. We found that there wasn't really any real recommendations in the literature on this, and so we decided to use an automated SMS text messaging method in combination with taking a trial within a study approach that involved 2 different study arms, each receiving a different type of text message to see whether or not this had any impact on wear time and levels of missing data. The cohort were randomly assigned to each of the study arms, with arm 1 receiving weekly SMS messages to their mobile phone. Each week, this message would be consistent and doesn't alter regardless of how much a participant wears their device over that week. The text message simply says, "Thank you for taking part in the study," and reminds them to wear their device and open the Fitbit app daily to send their data to us. The second arm also receive a weekly SMS message. However, the type of message that they receive differs depending on how much they wear and send their data to us. For example, if a device is worn for 4 or more days in a 7-day period, then the text message will say, "Thank you for taking part in the study. We have received X number of days of data from you." If the device is worn for less than 4 days in a 7-day period, then the message will again say, "Thank you for participating in the study. We have received X days of data from you," but it will also give a gentle reminder to them to keep wearing their device and sending their data to us. This then escalates if poor levels of data persist for 3 weeks, with the weekly message now explaining that we're having trouble receiving their data, asking them again to remind them to wear their device and send the data, and also to contact the research team if they need any assistance. And finally, as a catch-all approach, all participants, regardless of the study arm, receive a phone call from their clinical site if they fail to send 14 or more days of valid data within a 28-day period. This allows us to speak to them directly and to see if there are any problems that we can fix to reduce the levels of missing data. And finally, whilst this presentation has focused on the complexities involved in handling Fitbit data in terms of data management and monitoring, I would like to take the opportunity to quickly touch on some of the broader factors that are also extremely important to consider when looking to embed activity trackers into longitudinal studies. These factors will have a strong part to play when deciding on the most suitable device for your research, and to help understand the technical requirements in order to implement them in a clinical setting, and hopefully keep missing data down to a minimum. These include things like whether or not you need to give your participants feedback on their activity levels. Do you want them to be able to see their data or be blinded to it? How long is the data collection period going to be? Do you need to access data in real time in order to monitor use and act on missing data? Can you trust the brand or manufacturer of a given device? Has the device been validated for use in the cohort that you want to monitor? What metrics are you interested in, and can it provide the measures that you need? Something that we found to be extremely important to understand when trying to decide on our preferred device was finding out the views of across the HD community on using activity trackers. If you want people to wear something for long periods of time, then you need to ensure that you get end user buy-in. And so you need to try to make or to meet the preferences of the participants in order to promote device compliance. And as I mentioned earlier in this presentation, we have actually completed some of this research and have a poster presenting the findings, which I'd like to direct you towards for further information. And finally, once you have all of this data, you need to have a plan as to what you're going to do with it. How are you going to process it, clean and analyze it? And this type of data does not fit the traditional statistical approaches. And so you need to decide what you need to do to be able to answer your specific research question. For example, are you interested in composite measures? Do you want to identify changes in time? How will seasonality and missing data impact your data set? Do you need to create a discrete summary metric that feeds into a traditional statistical approach? Or are you going to apply machine learning methods? All of these things require careful consideration. In summary, I have hopefully demonstrated to you throughout this talk that the process of embedding activity trackers into longitudinal clinical studies is actually quite complex and is often underestimated. It is hoped that the information presented today will be of value to others seeking to use activity trackers in a similar application, and also to facilitate discussion surrounding the challenges and solutions to handling longitudinal wearable activity tracker data within a clinical study. I would like to thank you for listening and take this opportunity to acknowledge our consortium partners and funders. Thank you very much for your time.